Welcome to Evidence Mastery with Dr. Massoud Toussi. I am going to help you understand what type 1 diabetes is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice. In today's explainer, we're going to take a really clear, evidence-based look at type 1 diabetes. You know, it's an autoimmune condition that affects millions of people all over the world. We're going to break down the science behind it, how it's diagnosed, and maybe most importantly, the core principles of how it's managed. Okay, so here's our game plan. We're going to walk through 5 key areas. We'll start with the basics of what the disease actually is, and then we'll work our way all the way through to the strategies for long-term health. So let's dive right in. So first things first, to really get a handle on type 1 diabetes, we have to understand what's going on inside the body. And really, it all comes down to a case of mistaken identity, where the body's own defense system, the immune system, kind of goes rogue. So what's the official definition? Well, type 1 diabetes is, at its core, an autoimmune disease. Now, what does that mean? It means your immune system, the very thing that's supposed to protect you from germs and viruses, gets confused. It mistakenly targets and destroys these tiny, incredibly important cells in your pancreas called beta cells. And why does that matter? Well, these beta cells are the body's only factory for insulin. And insulin is the hormone that's absolutely essential for controlling our blood sugar. So when they're gone, the body just can't manage its glucose levels anymore. And this visual really brings it home. If you look on the left, you see a healthy pancreas. Everything's working as it should, with those beta cells intact. But then look at the right. This is what happens in type 1 diabetes. You can see these immune cells, called T cells, launching an attack. They swarm into the pancreas in a process we call insulitis, basically an inflammation of the islets where the beta cells live, and they just systematically wipe out those beta cells. And the result? A severe lack of insulin. So the big question is, what kicks off this autoimmune attack in the first place? Well, the evidence points to it not being just one thing. It's more of a complex puzzle. First, there's a definite genetic piece. Some people are just born with a higher susceptibility. But that's usually not enough. It's thought that an environmental trigger, maybe something like a common virus, is what pulls the trigger on that genetic risk. And there's even some ongoing research looking into possible links with things like diet very early in life. Okay, so we've seen what's happening on the inside. Now let's talk about how that translates to the outside, the signs and symptoms you can actually recognize, and how doctors make a formal diagnosis. It's really interesting because the disease doesn't just appear overnight. It actually moves through 3 distinct stages, and for a while it's completely silent. In stage 1, the autoimmune attack is already underway. You can find these things called autoantibodies in the blood, but blood sugar is still totally normal. Then comes stage 2. Here, the body starts to have trouble handling glucose, but the person still doesn't have any symptoms. They feel fine. It's not until stage 3, after a huge number of those beta cells have been lost, that the classic, noticeable symptoms finally show up. And what are those symptoms? Well, they're all directly caused by having too much sugar in the blood, which we call hyperglycemia. Think about it. When all that glucose builds up, your kidneys go into overdrive trying to flush it out. That's why people experience frequent urination and, as a result, really intense thirst. And because the body cells can't get the glucose they need for energy, you feel incredibly hungry. But at the same time, you might be losing weight without trying. It also explains the extreme fatigue and even blurred vision. Fortunately, confirming a diagnosis is pretty straightforward. It's done with simple blood tests. We can measure the glucose in the blood at that moment, but the really key test is something called the hemoglobin A1C, or just A1C. What's so great about the A1C is that it gives us an average of your blood sugar levels over the last 2 to 3 months. It's like looking at a long-term trend instead of just a single snapshot, which gives us a much more reliable picture. But how do we know for sure that it's type 1 and not another type of diabetes? Well, clinicians look for some very specific clues. Remember those autoantibodies we talked about? We test for those to confirm the autoimmune attack is happening. And there's another really important test for something called C-peptide. You see, when the pancreas makes insulin, it also releases this C-peptide molecule at the same time. So if we find very low levels of C-peptide, it's direct proof that the body isn't making its own insulin anymore. Okay, so we've covered what type 1 diabetes is and how it's diagnosed. Now, let's shift gears and talk about the core principles of actually managing the condition day to day. When we think about managing type 1 diabetes today, it's really built on 4 essential pillars. The first one, insulin therapy, is completely non-negotiable. You have to replace the insulin the body can't make. But, and this is a big but, it's not just about insulin. Just as important are solid diabetes education for self-management, a thoughtful approach to diet, and of course, regular physical activity. For things to go well, all four of these have to work together, in harmony. The whole goal of insulin therapy is to mimic what a healthy pancreas does naturally, and we do that with something called a basal bolus strategy. It sounds complicated, but it's not. Basal insulin is your background insulin. It's long-acting and it provides a slow, steady stream of insulin to keep your blood sugar stable between meals and overnight. Then you have bolus insulin. This is a rapid-acting insulin you take right before you eat to cover the carbs in your food. This two-part approach is really a game changer. It allows for so much more flexibility and helps prevent those big sugar spikes after meals. All right, none of this management works without keeping a close eye on things. Success really depends on diligent monitoring. So let's look at the targets we're aiming for and the tools we use to track how well we're doing. For the long haul, the main target we look at is that hemoglobin A1C again. According to all the major clinical guidelines, the goal for most people is to keep that A1C level below 7%. And there's a very good reason for that. The evidence is overwhelming that hitting this target dramatically lowers the risk of developing long-term complications down the road. But with modern technology, we can now see so much more than just that 3-month average. I'm talking about continuous glucose monitors, or CGMs. These things give you a dynamic, real-time picture of what your glucose is doing moment to moment. And with CGMs, the big metric we focus on is called time in range. The goal is to spend more than 70% of your day inside your target glucose range. This isn't just about avoiding highs, it's also absolutely crucial for preventing dangerous lows, or what we call hypoglycemia. So that begs the question, right? How do we actually collect all this crucial data day in and day out? Well, the old school way is the fingerstick test, which gives you a single blood glucose reading at one specific point in time. But honestly, the standard of care is really shifting and fast toward those CGM systems. These devices are amazing. They use a tiny little sensor that sits just under your skin and it continuously measures the glucose in the fluid between your cells. This gives you not just numbers, but trend data. Is your sugar going up, down, or staying steady? Plus, it can give you real-time alerts. And this brings us to the final and maybe most important piece of the puzzle. The ultimate goal of all this work is to prevent long-term complications. And to do that, you have to be proactive. It's absolutely essential. The evidence couldn't be clearer on this. Over time, chronic high blood sugar is really tough on the blood vessels all over your body. This damage can lead to what we call microvascular complications. That means problems with the tiny vessels in your eyes, your kidneys, and your nerves. It can also lead to macrovascular complications in the large vessels, which is what increases the risk for serious events like a heart attack or a stroke. And here's the thing, a lot of these complications can sneak up on you without any early warning signs. That's why being proactive with a regular screening schedule is such a critical part of good diabetes care. The recommendation is to start screening for any issues with the eyes, kidneys, and nerves within 5 years of diagnosis, and then to repeat those screenings every single year. On top of that, regular blood pressure checks and getting your cholesterol levels checked are standard practice to get ahead of any potential heart-related risks. So if there's one key takeaway, it's this: prevention is truly possible. The evidence is just overwhelming. Keeping tight control of your blood sugar and combining that with actively managing your blood pressure and cholesterol, that is, without a doubt, the most powerful strategy for living a long, healthy life with type 1 diabetes. I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.